Brilliant. So, look, today is the launch of our Mental Health and Race at Work report, which our colleagues and teams have been working on for since I think we kicked off probably about end of last year, November-ish, and just so proud of this piece of work because it's not been easy. It's a tough subject, and I was just reflecting this morning when we started the race conversation and looking at my diary. I found that the first conversation I held with our members and our member leaders was on the 18th of June last year. So almost exactly a year to the day we're launching this research. But when we kicked off the mental health and race conversation, or the impact of racism on our mental health, it was this time last year I wasn't feeling so confident and I wasn't feeling so great. And actually, I remember feeling really nervous about holding this discussion because I'm a brown woman and I didn't want people to feel like I was pushing my personal agenda. But at the same time, I could see the impact of COVID on Black and brown communities, my family, extended family being significant. And then, of course, the murder of George Floyd and the triggering impacts of that. So the City Mental Health Alliance have done what we always do, is hold a safe space for our members, be really courageous with the agendas that we're going to have a conversation about, and do it in a compassionate way. We held numerous listening events in September. We held an Inside Story event, which was very public, where people from our membership were talking about their lived experience. In January, we launched our Race and Mental Health Toolkit. In February, we launched our race research. And it goes on. So this is part of a whole series of conversations, dialogue, interventions that we've been putting in place so that our members and businesses can become psychologically safe places for all employees, because our vision is to create businesses that protect, support, and create positive mental health for everyone. So without further ado, over to you, Farima, to talk us through the race report, and then Fiona Cannon and I are going to have a short conversation, and then we're going to leave you all to read the report.
Thanks very much, Poppy. I was going to share my screen. Thank you, everyone. Nice to see you today. I'm just going to quickly run through some of the key findings from our report. Firstly, a bit of context. Who did we survey? Well, we surveyed over 1,000 people who are Black or from a minority ethnic background in the UK, who hold a range of jobs in the financial, legal and professional services industries. We really wanted to make sure that our respondent pool was representative of the people from the different minority ethnic backgrounds that were in our businesses. So we spoke to 18 different people from 18 different minority ethnic backgrounds. And we also surveyed a control group of 300 white British employees in similar jobs. Kind of a key focus of the early part of our research was to understand what experiences were people who are Black from minority ethnic groups having in the workplace that was impacting on their mental health. And one of the first things we looked at was racism. Sadly, racism continues to be a problem. It continues to be something that too many people are experiencing, which you will see has a particular high prevalence for people and employees that are Black. And it's 26% also experienced by 26% of East Asian employees, 24% of mixed race, 23% of South Asian, and 17% of white non-British. White non-British being people who are from continental Europe or the Republic of Ireland and areas like that. Unsurprisingly, this is impacting on mental health. Of those people who experienced racism at work, around 57% said it negatively impacted on their mental health. And it's not included here, but if you go to the report, it actually shows that experiences of racism at work are more likely to negatively impact mental health than experiences of racism in other public places, such as the street or on public transport. So there's a clear discrepancy there. We also looked at experiences at work that relate to feeling excluded or not being included. 54% of Black, 55% of South Asian, and 57% of East Asian employees say they feel able to be themselves at work. And this compares to 71% of white British employees who said the same. So there's a clear gap there in how comfortable people are feeling. And this is impacting on mental health. 52% of Black employees, 49% of East Asian and South Asian, and 45% of mixed race employees said feelings of not fitting in at work was a contributing factor to their poor mental health in the last 12 months. 4% of white British employees said the same. We asked in qualitative research, we asked how feeling you have to change who you are and feelings of not fitting in affect you. And some of the responses are, they're quite upsetting. Feelings like feeling isolated and alone, frustrated and embarrassed. Some people said feel anxious, not worthy, or just quite simply like I don't belong here. So clearly that shows that there is still work to be done. Not everyone feels like that clearly, but a significant percentage did feel like it was impacting their mental health, that lack of inclusion. We also wanted to ask about the state of people's mental health across all different ethnicities. Concerningly, but perhaps not surprisingly, given the year that we've had, an average of 72% of employees say that they have experienced poor mental health over the last 12 months. That's high and it's clearly something of concern, but is, as I said, not surprising given the very challenging year everyone has had. That was similar across all ethnicities, although the research does show that people who are Black or from a minority ethnic background are more likely to have experienced anxiety, and the ethnic breakdown is here, with it being particularly prevalent for people in a South Asian employee base. When we were looking at the mental health and how the challenges that people who are Black or from a minority ethnic background have and accessing support, one thing that we did look at was the cultural mental health stigma that there may exist, as that was coming up in some of the conversations that we're having. And the research bore out that people who are Black or from a minority ethnic background are more likely to say it in their culture there is a stigma in talking about poor mental health. The report also shows that people are less likely to talk about any mental health issues or concerns they have with their families and communities. And I think that's important context as we move on to talk about how the workplace can actually support people. You can see here that it's particularly prevalent in the South Asian and East Asian employee population. We moved on to talk about, well, so how do people feel about talking about mental health at work? What stigma exists? And the good news is that the majority of respondents from across all ethnicities think that mental health can be talked about openly at work. So if people have had mental health problems as a result of COVID or stresses, they are seeing work as a safe space. And we have the ethnic breakdown here on the right-hand side. And what is important about this as well, I think, is that those people from minority ethnic backgrounds who have high levels of cultural stigma also agree that work is a safe place to talk about mental health. Talking about mental health is one thing. We also wanted to find out about comfort in accessing support. Good news, and there's promising signs here, around half of all respondents from all ethnicities said they'd be likely to support offered by their organisation. Again, this applies to people that maybe have higher levels of stigma, which is good news. And half of all respondents said that their employer had proactively supported their positive mental health through the COVID-19 pandemic, with employees who are East Asian and mixed race being the most likely to agree with that. So I think there is clear evidence that the work that businesses have been doing to challenge mental health stigma in the workplace and to offer support, especially during a challenging last year, has been noted. Still clearly potential for more, but there's clear evidence that employees are recognizing it. We also asked what can improve, what can help people who are Black or from a minority ethnic background more likely to access support. A clear thing and a clear message that came through was diversity. Significant numbers want more diverse representation and understanding in the promotion and delivery of wellbeing support. And some of the specific examples that our respondents gave were things like having more people from a similar cultural background to talk to, for example, in mental health first aiders or mental health champions, whatever that you might have in your business, more diverse promotion of support. So it looks like more people like them would use the service, or it's for them, and more understanding of the issues that affect them, for example, the pressures of caring responsibilities or racism. We also noticed there was a gap in awareness of mental health support that's available at work. So this is especially clear in the South Asian and East Asian employee base. 52% of South Asian employees and 54% of East Asian employees are aware of mental health support, compared to 68% of white British. So there's a gap that can be closed there. And finally, this came through across all ethnicities. There's still a concern that accessing mental health support at work will impact their career. So over a third of respondents from all ethnicities would like more reassurance that accessing support won't hurt their career. That was a really whistle-stop tour of the report. There are many more facts there, but I just wanted to pull out some of the key findings that kind of came out to us immediately, but I'll stop there and hand back to you, Poppy.
Farma, thank you for that summary. Please do read the report. It's very good. It's not very long, and it's actually very easily digestible with practical things that you can do. Farma, I really wanted to say thank you to you for driving this. I know it's not been easy at times, especially when you were going through the case studies and stuff. So genuinely heartfelt thank you for driving this and coordinating this. You're amazing. So I'd like to just welcome Fiona on and to have a 10-minute chat, Fiona, from both of our perspectives. Fiona is the Director of Sustainable Business at Lloyds Banking Group, and I guess me and you are the sponsors for this piece of research. So what are your reflections on the findings so far?
So I mean, I think the main reflection, if I'm honest, Poppy, is kind of sadness and a bit shocked, I guess, for some of the statistics. If you look at the fact that 45% of Black people have experienced racism at work, and then the consequent negative impact on their mental health and well-being. So I think that's been one of the kind of big takeouts for me, and I guess it's not surprising to see how living through the pandemic has impacted on people's mental health, but obviously there is a significant more adverse impact on Black, Asian and colleagues from ethnic minority backgrounds. I think the good news is that people say they can talk more openly, as Farima was saying, about mental health in the workplace. And I think, the big thing for me, the big takeout is really just showing what a vital role employers can play in this space in terms of protecting, supporting and creating positive mental health by taking, particularly around the issue of race, by taking an anti-racist position and building inclusive cultures. So I think that's the overwhelming piece, but I think all of us as employers should take note of some of those statistics, which are really pretty shocking.
Yeah, you're right. And do you know what you were saying at the beginning, that actually some of it's surprising. What from my perspective, I feel really sad that I'm not surprised by the data. Do you know what I mean? And I feel like actually I wish I was a little bit more surprised by it, and in a good way, rather than reaffirming the status quo, I suppose. So that felt a little bit sad. But I think the you're right. What I was really reassured by is the work that our members and that we've been doing in the mental
Yeah.
health space in work has started to pay off, because most people, I think I saw data which was around about the 70s, are happy to access support at work and feel safe to do so. And we really need to major on that. We really need to get that to 100%. Like, I reckon if we'd asked that question 5 years ago, it would have been more in the 30%.
Yes, I
So
agree.
that, I think, is brilliant. And I think from a um, cultural perspective, people, particularly from Asian communities, I thought that was brilliant. That the fact that you might not speak to your family members or your community because of, and I think there's a great quote in the report, but because of your anxieties around how you might be seen in the family and in the community, but you will at work. And that's
Yeah.
really important insight for businesses. Imagine if 100% of the people knew where they could get support and felt reassured that they could access it without it having an impact. That, I think, is a really good comms strategy, needs to be sat behind that.
I completely agree. I mean, you're right. We've all been working on mental health now for a good few years, and I think the good thing about that is it has started to remove the stigma more generally and raise awareness of mental health at work. So it's started to create the right kind of supportive environment. And so what we need to do now is to go more in depth, as we're doing here, as your research has focused on, in terms of some of the areas where there's still more to be done. And that's what I mean about the vital role that businesses can play. I mean, businesses can provide a real safe space for individuals to come and get the support that they need. And then through that, we as businesses can start to think about what additional work do we need to do, particularly amongst the Black, Asian and minority ethnic communities, to start to help reduce some of the stigma around mental health that continues to exist.
And Fiona, what work have you already done? And a second part to that question, what will you do as a result of the report? I know we've got to take time to digest it, and we've only just sort of landed on our tables. But what are you already doing, and what are you going to change or do more of as a result?
So we've been doing quite a lot around race for a good few years now, but I think last year, when George Floyd was murdered, it became very clear that there was significantly more for us to do, particularly for our Black colleagues who remain significantly underrepresented within the organisation. And so last July, we launched a race action plan, publicly, which was really around driving cultural change, focusing on recruitment and progression, because diversity and seeing people like yourself in an organisation is really, really important, as well as kind of supporting our broader communities. And I think one of the really important things that we did as part of that was to set up race advisory panels that were made up of Asian heritage colleagues and Black heritage colleagues. And that was really important because it meant that we had kind of expert groups we could talk to, who had lived experience that could help us as we kind of shaped the work that we were doing. And that's been really helpful to us as we've worked our way through it, because one of the things that has really struck me around race is how little many of us know about the issues of race and how it impacts on our colleagues. And certainly there's always been a bit of a concern about talking about race. And so using the race advisory panel the way that we have done has really helped us kind of work our way through some of those issues. And we've also done a big race education program, starting with our board, actually, with our executive team, to really, talking about how do you have difficult conversations around race. And that's been really important. But I think what's become really clear, and obviously we've been doing a lot around mental health already, in terms of mental health advocates, mental health training. But I think what became really clear from these results of the findings is that we need to put more tailored support in place for our Black, Asian and minority ethnic colleagues. So some of the things that we're looking at now, beyond the activity that we've already got, is to make sure that we've got more diverse representation in the promotion and delivery of our existing support channels. So we've got our employee assistance program, Validium, for example. We want to make sure that the people that are involved, the counsellors that are involved in there, are diverse, and also making sure that our mental health advocate program has diverse individuals in there as well. So because we talked, Farima talked earlier about the research about wanting to be able to talk to people who are similar to you, and I think that's really, really important. And we're providing specialist training for that as well. But we've also piloting a new support program at the moment called Safe Space, which is facilitated by experts in race. It's around having Black, Asian and minority ethnic colleagues speaking together with an expert on race and a counsellor, a diverse counsellor as well, in order to really create that safe space. And so that's one of the things that I think came out very much from the research that we'll be really looking to do. But also we'll continue with our training of, we've got 1,200 colleagues as mental health advocates. We'll continue to do that. But I think, you know, you thanked Farima, and I'd like to thank both you and Farima for doing this research, because we're really pleased to be collaborating on this, because I think it supports our commitment to build an inclusive organisation. But hopefully the personal perspectives that are in there will help inform businesses about what more we can all do and inspire action. And I think the biggest thing is about creating an anti-racist, inclusive working environment for everybody. So those are some of the things that we're doing, but really taking some of the learning from the research to enhance the activity.
Yeah, I mean, there's nothing better than when research gets implemented and it's not just sat on a shelf collecting dust. And I think that's this research is definitely, I mean, you've already spoken to 3 or 4 things that you're going to change or develop further as a result. And I really do believe that our members are going to take on board some of the stuff that's come out and think about revising their agendas or their strategies around mental health as a result of it. And I think also, just to say, when you address some of the issues that are experienced by the people that are most excluded or most challenged in a community, you improve the mental health of the whole community.
Of course, yeah.
Sometimes that gets a little bit lost when I've heard, and just briefly one comment from you on this, maybe, Fiona, you know, there seems to be a bit of a, do we do inclusion and diversity or do we do well-being? Like, my view is you can't do one without the other. So have you got a thought on that, Fiona, just so that we can square that off?
Absolutely. I mean, you know, they're completely interrelated. I mean, one of the interesting things for me about the wellbeing piece that we've done and more broadly in the mental health, you know, one of the issues that people often say is that, you know, they worry about going down a kind of strand specific activity around diversity, for example. But wellbeing is one of those things that cuts across everything, because everybody can be impacted by mental health. It doesn't matter what community you're in, doesn't matter how old you are, doesn't matter what level in an organisation you are, that actually well-being is around everybody. And actually it's a really uniting piece in terms of diversity and inclusion activity within the organisation. That's been our experience, because everybody can see. Sometimes people say about diversity, oh, if I'm not in a particular group, then I can't see what's in it for me. But actually, when you look at mental health and well-being, there's something in it for everybody, and that means, therefore, that you need to focus on everybody, and they're completely interrelated. And I don't think you can have one without the other, because you're looking for the well-being of your whole organisation, and your whole organisation is made up of lots of different people with different needs. And so therefore your well-being strategy absolutely needs to focus on that. And sometimes, you know, you might want to do a particular focus on a particular group, as we're doing a little bit now today, focusing particularly on race. But we do that all the time in business if there's a particular issue that we need to focus on. So you know, in order to kind of raise the profile and then be able to kind of fix any particular issues. So I think that's perfectly kind of normal activity from a business perspective. But I think they're absolutely, I completely agree with you. They are completely integrated.
Thanks for that, Fiona. And yeah, this sort of, so strategically, I just really, again, want to say this to everybody that's listening, because there's D&I leads as well as well-being leads. The 2 teams need to work together, and by doing one, you're not taking away from the other. The strategies need to be aligned. And sometimes I think we get into important debates about resources and where the money's coming from and where the budgets are coming from, and I think when you that's an agenda for senior sponsors and board level people to actually really think this through and make sure
Yeah.
that we're not creating problems down on the implementation level around, oh well, everybody's doing race now or everybody's doing gender now. It's mental health and well-being and the intersectionality of it all. You're not going to succeed in your mental health strategy or your diversity strategy if the two aren't together.
And it's probably, I couldn't agree more. And it's probably worth saying that, the well-being, the overall strategy of well-being sits with me in the organisation, and I own inclusion and diversity as well. So for us, we absolutely see them connected, and that's structurally how we've organised it. So because the two are completely interrelated and you can't have one without the other. So yeah, no, absolutely agree.
Thanks, Fiona. And once again, thanks to Lloyds Banking Group for supporting this research, and everybody, and particularly the race advisory panel for helping us think through the methodology, the questions we should be asking. We really couldn't have done it without them. So we're drawing to an end with the event. It was only half an hour, just high level, to launch the report. There's going to be a number of other conversations, programs of work that result out of this that will fit into the overall strategy of the City Mental Health Alliance. I've noted that there are a number of questions that have come up. If they haven't been answered in the chat already by one of the team, Farima will pick them up afterwards. But what I do want to do is just catch you all in the moment, and from what you've heard so far, is there a sentence or a word or something that you could put in to the chat so that we can get a feel of how this is landing with you as I close the event? What else have I got to say that the team are going to be annoyed if I don't? Right, so we want you all to read the report and make sure that it goes to your communications people, your managers, your business unit leaders, so that everybody's got at least the high level, these are the 2 or 3 things that you can all do. Kate, maybe you can just put up that slide. In the report, we've created a framework of 5 actions that we think every business and CMHA members and non-members can do. So these are the actions. I'm not going to go through them, but please do read the report and move from empathy to compassion, which is, for me, taking steps and action to create a more inclusive and psychologically safe mental health and psychologically safe and mentally healthy environment for all people. I think my other 2 or 3 reflections as I close is, when we're having the race conversation, we're always thinking, rightly so, about the people that experience racism. So usually Black and brown people, or non-British, white non-British people, as we've seen in this research. But the impact of racism on our colleagues, it's almost sort of like, well, actually, does it not affect our white colleagues? And I know that for a fact that, for example, in our board, when things have come up that have been challenging, most of our board are white colleagues. And actually, the hurt that is experienced by everyone when we exclude people is really, really profound. And the team dynamics that is hurt as a result of that is really profound. So when we get this stuff right, and particularly when we get discrimination nipped in the bud, we actually create environments that foster belonging. And if you can create that, I think we would create society that would be very different to where we're at today. So I just wanted to say that it affects everyone. It's not a Black and brown people agenda. It's not just a minority ethnic community agenda, and it affects everyone because it hurts everyone. The 3 things that I think, let's revise our comms strategies and plans based on what we've heard today and what the report said. I think the race advisory panels are an important part of organisations and in order to help lead with lived experience. And the other thought I was having as I was reading this is, if there are cultures and communities that aren't able to talk about mental health in a way that the biggest, broader society does, then what can we as businesses do in terms of social impact and the ecosystems that we sit in? So if you're in Birmingham or Manchester or Bradford, where there are bigger Asian communities who aren't talking about mental health, could we run projects and socialize the mental health agenda in those communities so that we're supporting our employees outside of the business as well as inside? So that's a thought that I'll leave you with. I'm 1 minute over. I'm going to say thank you to everyone. We've got a very short video of 2 minutes. If you have got time, do stay and watch that, and we'll see you all another time. Once again, thanks Fiona, thanks Farima, and over to you, Kate, to end and close the event with our video.
When you do have the anticipation that you go into your office and you're going to have to in some way water it down or navigate this really complicated space of like, okay, how do I want to present myself today to make sure that I'm, seen as a professional?
And being in an office with people, 5 times out of a 7-day week, they basically become your family. But when you first enter there, especially as just coming fresh out of uni, it is very daunting, and it's even more daunting if you're the only Black person.
You may end up being in a company where just the reality is there's not many people who look like you or have your background, but if the people in the room actively champion for you, despite differences in their own lived experience, it can do so much for your mental health. So that's probably the biggest benefit to my mental health for working at the FT.
From experiences as a South Asian person and having led the Muslim network at my organisation, my colleagues have told me they feel more comfortable to talk about their mental health at work than with their communities because of stigma in their culture or in their family.
And it was actually my boss at the time who reached out to me to say, I'm quite concerned. Work and talking about mental health, learning about mental health can really bleed positively into your personal life.